Okay, so case of the week, very interesting client comes in. 56-year-old female, lifelong runner, lives in the mountains, has had a problem with her hip. When we start discussing the hip and the leg, what we find out is 6 years ago, she had a procedure that a doctor talked to her about called the pie crusting procedure. Basically what it entails is she had a very tight IT band, and she had had that all her life. It was starting to affect her hip. The doctor goes in and makes lateral cuts along the lines of the IT band, and that loosened the IT band up in both directions so that she no longer had any pain in the IT band. That lasted for 5 years. A year ago, it started tightening up in her hip, and she had a rotational issue. Every time she took a forward step, she felt it in her hip. She also said that her knee was very tight. So these are the pain sites that she talked about. Up here is the rotation into the hip where she felt the direction was being pulled. The X marks the spot where she felt pain. Down here is where the cuts were made with a pull in this direction. So what I started with was just mild fascial release on the entire IT band, pulling medial. She winced in pain. In fact, she gave a little yelp. What happened was I asked her what it felt like. She says it felt like it was burning and it felt like it was skin tearing, which in my experience has to do with a fascial restriction. I followed that fascial restriction all the way up the thigh, going in direction of ease and then coming back and pulling off the direction of the pull. And then I stretched in both directions and moved the IT band, eventually pulling skin along the line. This took about 11 to 12 minutes. When I was done with that, she had no pain. The pulling that she'd been talking about was gone. She's an anatomist. Back in the day, she went to massage school in Canada and asked about what I had done, and when I explained it to her, it totally made sense. I checked up with her 2 days later. She had been running for the last 2 days. There'd been no pain, there'd been no pull, and she felt a lot better. It's a very simple fix.